Now we are going to see skin preparation for surgical site. If patient is going for the surgery, how we have to do cleaning in the skin, how we have to prepare the patient. That everything we are going to discuss today. First we will see the definition, then purpose, special consideration and area of the skin preparation. First I will start with the definition. Skin preparation is the removal of as many bacteria as possible from the patient's skin through shaving, mechanical washing and chemical disinfection. Here our main focus is removing the bacteria from the skin. From which method we are doing means shaving method, mechanical washing and chemical disinfection. Shaving method means with the blade and razor method we can use. Mechanical washing means through the trimmer. Nowadays the electrical trimmer they are removing the hair. And next one is chemical disinfection. That means we are using some solution. For example, betadine scrub or soap or something we are using and we are cleaning the skin. So this is the definition of the skin preparation. Next, purpose. Reduce the number of microorganisms in the field of operation. For example, if surgery in the abdomen means our focus to reduce the microorganism in the abdominal area. Then second one is to prevent infection. If we are clean properly means we can prevent the infection. Next we are seeing the special consideration. That means what are the things we have to think specially we can concentrate on the patient side. Determine the area to be saved. Know the operation to be done, the organ involved, its location and the proposed incision. In which part they are doing surgery, that everything we have to identify before itself. We can clean this place thoroughly. Practice modesty and provide privacy. When they are doing this skin preparation, compulsory we have to make a privacy. Ask the patient permission to cutting the eyelashes and hair. So when we are doing this skin preparation, we have to get the permission from the patient because they have to believe some culture, they have to believe some religions, they don't like to cut the hair. So we have to get the permission from the patient. Examine the area to be shaved for any sign of irritation or any abnormal condition. Report to your head nurse. So which place we have to do skin preparation? First we have to observe. If anything we can find abnormalities, immediately we have to inform to the nurse or doctors. Do not cut the patient's skin. That means when you are doing the skin preparation, be careful. Don't cut the skin. By mistake it will happen, but we have to put more concentration. So next we will see the area of skin preparation. Which surgery, how we have to clean the patient's skin. First one is we are starting with the skull, head. So if it is the operation in the skull area, head portion means how to do, which are the part we have to do preparation. Entire skull, forehead, ears and neck. In this place we have to do skin preparation. For example, craniotomy surgery or tumor excision. Like this operation, how to do skin preparation means they have to remove the full hair of from the head, and forehead also they have to remove the hair, and ears and neck. In neck side also any hair is present, they have to remove totally. Next, if any surgery on the face, for example ENT surgery, septoplasty or thyroidectomy surgeries, any eye surgery or any mouth they are doing, accident happen, so all the teeth are fall down, so mandibular surgeries, ORIF surgery. In this time how to do skin preparation? Entire face, neck, if necessary including the ears, they have to do the skin preparation thoroughly. Next, chest or supine. If any surgery in the chest pass related to the heart, related to the lungs, related to the breast, any surgeries is happening, how to clean the skin from mid abdomen to the shoulder and neck, extending laterally round the line, the thorax on the both side. So entire portion, the chest portion we have to clean properly, we have to remove the hair. For example, compare than female patient, male patient is having more hair in the chest. So through proper solution, through proper method, they have to remove the hair from the skin. Chest means, for example, CABG surgery, coronary artery bypass grafting, open heart surgery. In that time, they have to do fully from neck to up to abdominal. They have to clean thoroughly. They have to remove the hair properly. Then any abdominal surgery, how to clean the skin from the nipple to the upper part of the thigh, extending laterally around abdominal wall and pelvis both side, including genital region. If any abdominal surgery means, for example, a laparotomy surgery and laparoscopic hernia, appendectomy, cholecystectomy, any these type of surgery means from where to where they have to clean means from the nipple to upper part of the thigh, up to thigh they have to clean, including genital area they have to do skin preparation. Next, the surgery in the genital region, how to clean from the umbilicus to mid thigh, extending laterally round the pelvis, including genital area and anal region. If patient is having genital surgery, for example, normal delivery or hemorrhoidectomy or fissurectomy, like that, any reproductive relative surgeries means how to clean. From the umbilicus they have to start the cleaning, from the umbilicus to and pelvis point, that means genital area up to anus, they have to do skin preparation properly. Next, any spinal surgery. Spinal surgery means is nothing but backside. If any spinal cord injury or any discectomy, laminectomy surgery means how they have to clean the spinal from the shoulder to upper part of the thigh, including anal region, extending laterally round the groin and thorax. So here totally backside of the neck and private part up to paddocks they have to clean. Before the paddocks point they have to clean properly. Why we have to clean private part in this area, genital area means, in that surgery time, before starting surgery, they will insert the Foley's catheterization. So to prevent infection, we have to follow all the healthy measures. So spinal surgery, laminectomy, discectomy, like that procedure means they have to clean thoroughly backside. Hand, forearm, upper arm. How to clean? If anything fracture in the happen into the hand, accident happen in the fingers, how to clean means from the fingertip to elbow they have to clean, because for example in brachial part any accident happened. So how to clean means from fingertip to elbow, even sometimes up to shoulder also we can do the skin preparation. So hands means how to do cleaning means from fingertip to shoulder they have to do skin preparation, as well as they have to clean properly. And foot and ankle, if it is happening in the leg side, foot and ankle means how to clean from the toe to knee level for full circumstance of the limb. So if anything surgery in the leg, for example cellulitis, amputation, any surgeries means how they have to clean means from the toe to knee level of the full circumstance of the limb. So totally they have to do cleaning, skin preparation. This all about the area of the skin preparation for the surgery. First we see definition. After definition, purpose, special consideration, and which area, which surgery, which part we have to clean. How to clean means this is the part of the preparation. If it is head means we can do this like this. Here the any tonsillectomy procedure means we can clean up to in this area. Here any ENT surgery means, ear related any surgery means we can do the skin preparation in this part. If patient is having any kidney surgeries, that means any transplantation, KTP, kidney transplantation, that time we can do the preparation like this. So this all about the skin preparation for the surgery. Thank you.